Soul diseases, clinical syndrome. Illnesses of the soul are a complex and multifaceted topic that has been studied and debated over the centuries by psychologists, psychiatrists, and other mental health professionals. While the term diseases of the soul can have different meanings for different people, it generally refers to the emotional, psychological, or spiritual conditions that have impacted on a person's well-being and their ability to live a full and satisfying life. In this text, we will explore some of the main diseases of the soul, their causes, symptoms, and treatments. Depression. Depression is one of the most common and serious illnesses of the soul. It can affect people of all ages, genders, and backgrounds, and can be triggered by a variety of factors including stress, trauma, relationship issues, physical health conditions, drug or alcohol use, among others. Depression can manifest itself in many different ways, but the most common symptoms include feelings of sadness, despair, or emptiness, loss of interest in activities that were previously pleasurable, fatigue and lack of energy, sleep disorders, weight loss or gain, feelings of guilt, worthlessness or hopelessness, difficulty concentrating and making decisions, suicidal thoughts or self-destructive behavior. Depression treatment usually involves a combination of psychological therapy and antidepressant medications. Cognitive behavioral therapy is one of the most effective approaches to treating depression and can help people identify and change patterns of thinking and behavior that they have come to understand for their condition. Antidepressants can help alleviate symptoms of depression, but they must be used with caution and under medical supervision. Anxiety. Anxiety is another common soul ailment, which can affect people of all ages and backgrounds. It can be triggered by a variety of factors, including stress, trauma, genetics, and other environmental factors. Anxiety can manifest itself in many different ways, but the most common symptoms include excessive worry or anxious thoughts, physical symptoms such as sweating, tremors, palpitations, and nausea, intense fear or panic, avoidance of situations that trigger anxiety, preoccupation with things that are out of proportion, difficulty relaxing, irritability or muscle tension. Anxiety treatment usually involves a combination of psychological therapy and anti-anxiety medications. Cognitive behavioral therapy is an effective approach to treating anxiety and can help people identify and change patterns of thinking and behavior that are consistent with their condition. Anxiolytics can help relieve anxiety symptoms, but they should be used with caution and under medical supervision, as they can be addictive and have side effects. Eating disorders. Eating disorders such as anorexia, bulimia, and binge eating disorder are diseases of the soul that have taken over the way people eat and think about food. They are usually triggered by emotional issues such as low self-esteem, anxiety, or depression, and can lead to serious physical problems such as malnutrition, organ damage, and even death. Symptoms of eating disorders vary by type, but can include excessive food restriction, anorexia, binge eating followed by vomiting or use of laxatives, bulimia, binge eating without purging, binge eating disorder, excessive preoccupation with body weight and shape, covert eating behaviors, social isolation and loss of interest in activities that were previously pleasurable, difficulty dealing with emotions. Treatment of eating disorders usually involves a combination of psychological therapy, nutritional counseling, and, in some cases, medication. Cognitive behavioral therapy is an effective approach to treating eating disorders and can help people identify and change patterns of thinking and behavior that follow their condition. Nutritional monitoring can help people develop healthy eating habits and regain proper weight. Medications may be prescribed to treat coexisting conditions such as anxiety or depression. Addiction. Addiction is a disease of the soul that develops when a person becomes dependent on a substance or behavior. Addiction can affect people of all ages and backgrounds and can be triggered by a variety of factors, including genetics, stress, trauma, and mental health issues. Addiction symptoms vary by type, but can include intense, compulsive craving for the addictive substance or behavior, continued use despite negative consequences, tolerance, i.e. the need to use more of the substance to feel the same effects, withdrawal symptoms when the substance is stopped. Addiction treatment usually involves a combination of psychological therapy, support groups, and, in some cases, medication. Cognitive behavioral therapy is an effective approach to treating addiction and can help people identify and change patterns of thinking and behavior that conform to their condition. Support groups, such as Alcoholics Anonymous or Narcotics Anonymous, can provide a supportive and understanding environment for people struggling with addiction. Medications may be prescribed to help ease withdrawal symptoms. In conclusion, diseases of the soul are conditions that have experienced a person's mental and emotional health, affecting his physical and mental well-being. These illnesses can have a significant impact on a person's life, but it is important to remember that they are treatable and that there are many treatment options available. It is essential to seek professional help when necessary and not be afraid or ashamed to ask for help. Taking care of mental health is just as important as taking care of physical health, and it is essential for a full and happy life.